Over 60 and starting to feel the quiet complaints of your body, swelling around the ankles after a short walk, a stiffness in your knees when you stand up, a faint tingling along your shins that makes you wonder if you slept the wrong way. You are not alone, and you are not broken. Much of what you're noticing traces back to a single, underappreciated network that holds you together: collagen. Collagen is the primary structural protein in skin, tendons, ligaments, cartilage, and the lining of your blood vessels. It behaves like scaffolding and shock absorber, at once giving your joints glide, your skin firmness, and your vessels elasticity. Beginning in mid-adulthood, your body's ability to build and remodel collagen slows. By your 60s, turnover is noticeably reduced, so wear and tear outpaces repair. The good news is that with consistent daily choices, you can give your body the raw materials and cofactors it needs to support that repair cycle. Tonight, we'll walk calmly and clearly through 6 time-tested foods and the science-based habits that help them work for you. Along the way, I'll flag sensible precautions, because medically accurate doesn't just mean what to add. It also means when to pause, how to prepare, and what to discuss with your clinician if you take certain medications or live with specific conditions. Before we get practical, a 2-minute primer. Your body doesn't absorb whole collagen as if it were a spare part. You digest collagen-rich foods into amino acids and small peptides, especially glycine, proline, and hydroxyproline, that your cells can reassemble into new collagen where it's needed. That assembly process also depends on vitamin C, copper, zinc, and adequate overall protein, plus steady blood flow to deliver nutrients to working tissues. That is why success here is never about a single superfood. It is about the steady pattern: enough protein across the day, the right building blocks, the micronutrients that activate enzymes, preparation methods that preserve what you're aiming to get, and gentle movement to stimulate circulation. With that frame, let's move to the kitchen. Let's start with plain, unflavored gelatin. Think of gelatin as collagen that has already been partially unraveled by heat, which makes it easy to dissolve, easy to digest, and remarkably gentle for older stomachs. A typical serving that has been studied falls around 5 to 15 grams per day. A practical target for most adults is about 10 grams daily, stirred into warm water, tea or coffee, or blended into a simple fruit gel, set with real fruit and minimal added sugar. Those small collagen peptides are not magic, but clinical trials suggest they can support skin hydration and elasticity and reduce activity-related joint discomfort when used consistently over 8 to 12 weeks. If you're monitoring sodium, choose a plain product with no additives. If you prefer animal sourcing transparency, look for grass-fed or pasture-raised on the label. For best absorption, pair gelatin with vitamin C, a squeeze of lemon, a handful of berries, or half a kiwi, because vitamin C is required by the enzymes that cross-link new collagen fibers. If you take medications that require an empty stomach, separate those from your gelatin drink so the timing is clean. If you have a history of kidney stones, remember that hydration remains your ally. The protein load from gelatin is small, but general fluid goals still matter. Now let's open a tin of sardines. They are small, affordable, shelf-stable, and because you can eat them with skin and tiny bones intact, naturally deliver collagen, calcium, phosphorus, and marine omega-3s, EPA, and DHA. That combination supports joint lubrication, vascular health, and anti-inflammatory signaling. Choose sardines packed in water or olive oil rather than refined seed oils. And if you're watching calories, drain the oil, but keep the fish moist with lemon juice and herbs. Enjoy them on whole grain toast, flaked into a tomato garlic skillet sauce, or tossed with arugula and citrus. If you live with gout or hyperuricemia, sardines are higher in purines. Talk with your clinician about frequency that fits your plan and balance them with lower purine days. If you take anticoagulants, omega-3s have mild antiplatelet effects. This is usually compatible, but it's worth letting your care team know you're adding fish several times a week. For most older adults, 2 to 3 sardine meals per week is a realistic and beneficial rhythm. Next, a bright bowl of ripe papaya. While papaya does not contain collagen, it supports collagen synthesis in two useful ways. First, it's rich in vitamin C, which, as mentioned, drives the enzymes that knit collagen strands into strong fibers. Second, ripe papaya provides papain, a natural proteolytic enzyme that can help you access the amino acids from the rest of your meal. A practical edge if your digestion has slowed with age. A half to 1 cup of ripe papaya in the morning or as a snack is an easy habit. Blend it with lime and a few mint leaves, or cube it and sprinkle with a pinch of chili and salt for contrast. If you're on a latex fruit cross-reactivity allergy spectrum, or you've ever noticed mouth itching with papaya or kiwi, approach cautiously and check with your clinician. If you manage diabetes, remember fruit serving sizes. Papaya can fit, but portion awareness is part of medically sound nutrition. It's time to reconsider chicken skin. For years, many of us peeled it away, lumping it with things to avoid. In reality, skin-on chicken prepared well is a practical source of type 1 collagen and elastin. The catch is the cooking method. High-temperature deep frying promotes the formation of advanced glycation end products, AGEs, that can irritate tissues. Slow roasting, baking at moderate heat, or simmering in soups keeps collagen intact without the oxidative burden. A simple approach is to roast bone-in, skin-on thighs at moderate heat until the skin is just crisp, then blot excess surface fat and pair the meat with a big plate of vegetables and a whole grain. If you have elevated LDL cholesterol or are on a heart protective plan, keep portions modest, favor simmered preparations like soups and stews, and make room in the week for fish and legumes as primary proteins, so saturated fat averages stay aligned with your targets. From there, it's a short, aromatic step to bone broth. Properly made bone broth is less about trend and more about technique. Long, gentle simmering of joint-rich bones releases gelatin, collagen peptides, and small amounts of glucosamine, chondroitin, and hyaluronic acid, the same family of compounds that cushion cartilage and retain water in connective tissues. The method is straightforward. Cover beef knuckle bones or a roasted chicken carcass with cool water. Add a splash of apple cider vinegar to help draw minerals. Tuck in onion, celery, carrot, and bay leaf for flavor. Then bring to a bare simmer and keep it there for 12 to 24 hours, skimming occasionally. Strain, chill, and you'll know you did it right if it sets like soft jelly in the fridge. Warm a cup in the morning, use it as the base for soups, or reduce it to a glaze for vegetables. If you are on a sodium-restricted plan, salt lightly during cooking and season in the cup so you can control the final amount. If you are concerned about trace contaminants, source bones from reputable suppliers and avoid adding vinegar in excessive amounts. Normal culinary use is appropriate. Bone broth is not a cure, but as part of a balanced pattern, it can make achieving daily protein and collagen-supporting peptides easier and more pleasant. Finally, let's talk about liver. Many older adults grew up with the taste and either loved it or swore it off. From a clinical nutrition standpoint, small amounts of liver are extraordinarily dense in vitamin A, retinol, B12, folate, iron, copper, and zinc. Micronutrients that help your body turn protein into functional collagen, maintain healthy skin turnover, and support red blood cell production for oxygen delivery to working tissues. Because vitamin A is potent, the dose and frequency matter. For most adults, 1 to 2 ounces, 30 to 60 grams, once weekly is plenty. Blend a small amount of sautéed, cooled liver into ground beef for meatballs or chili, or spread a thin layer of pâté on whole grain toast with a squeeze of lemon. If you are pregnant, planning pregnancy, have hemochromatosis, or take medications that affect vitamin A metabolism, liver may be contraindicated. Ask your clinician. If you take warfarin or another anticoagulant, remember that liver is not vitamin K dense like leafy greens, but any major shift in diet warrants a heads up to your care team to keep your dosing steady. Now let's knit these foods into a practical weekly rhythm. Imagine a calm 7-day cycle where you don't overhaul your life. You just add 1 or 2 collagen-supportive habits per day and protect them. On Monday, you stir 10 grams of plain gelatin into warm tea at breakfast and add half a papaya with a squeeze of lime. At lunch, you enjoy a hearty vegetable soup built on homemade bone broth, rich with carrots, leeks, and barley. On Tuesday, sardines join the plate, mashed with lemon, parsley, and a dab of yogurt on rye toast, while dinner features a baked, skin-on chicken thigh alongside roasted broccoli and sweet potato. On Wednesday, you repeat the gelatin and coffee and add berries for vitamin C, then sip. Oh, let's also talk expectations. Collagen turnover is slow by design. Connective tissues are meant to be durable. That means you're looking for steady, cumulative improvements across weeks, not overnight transformations. What should you watch for? Many people notice first that morning stiffness shortens. Ankles feel less heavy after sitting. Skin looks better hydrated, and longer walks feel more comfortable. Those early signals tell you the pattern is working and worth keeping. If, after 8 to 12 weeks of consistent practice, you aren't noticing any change at all, revisit the basics. Are you hitting daily protein goals, including vitamin C-rich produce, moderating alcohol, which interferes with collagen synthesis, sleeping adequately, and moving the joints you want to help? Often it's the unglamorous fundamentals that flip the switch. A word on supplements versus foods. Hydrolyzed collagen powders can be convenient, and some clinical studies show benefits for joint comfort and skin measures when taken regularly. If a powder helps you meet your daily target, that's reasonable. Choose a third-party tested product and keep the dose modest. But do not skip the food pattern we've outlined. Sardines bring omega-3s and minerals, papaya brings vitamin C and enzymes, chicken skin and broth deliver culinary peptides inside real meals. Liver supplies the cofactors that make any protein you eat more useful to your tissues. Supplements at best are additions to, not replacements for, the nutrient-dense foods that carry many benefits at once. As you settle into this, allow your kitchen to be simple. Keep canned sardines, cartons of broth you made last weekend, and a bowl of ripe fruit within easy reach. Prepare bone broth while you're doing other things at home. Buy chicken pieces with skin and bones, cook them gently, and let leftovers become tomorrow's soup. Blend a small amount of liver into food you already enjoy so you don't have to force a flavor you dislike. Stir gelatin into a cup you already drink. None of this asks you to become a different person. It asks you to make small decisions, repeatedly, that feed the body you already have. Finally, remember that food is powerful but not a standalone cure. If swelling is new or asymmetric, if pain is severe, if night cramps are frequent, or if numbness is spreading, those are reasons to be seen promptly. Nutrition is part of the plan, not a substitute for diagnosis. Bring your clinician into the loop on what you're adding, especially if you take anticoagulants, have gout or advanced kidney disease, or are managing heart failure and sodium restrictions. So your medical care and your kitchen work together. Stronger joints, calmer tissue, steadier steps, and skin that looks like it's been treated kindly. These are reasonable goals at any age. Collagen is your ally in reaching them. With 10 grams of plain gelatin most days, sardines on the plate a few times a week, ripe papaya for vitamin C and digestive help, skin-on chicken cooked low and slow, deeply flavored bone broth simmered in your own kitchen, and a respectful once-weekly ounce or two of liver for the cofactors that make the whole system go, you give your body exactly what it asks for: the building blocks, the spark, and the time to rebuild. Keep your expectations steady, your portions sensible, your movement gentle and regular, and your mindset patient. Week by week, the quiet complaints in your legs and joints can soften, circulation can improve, and you can feel more at home in your own body. supported from the inside out by choices you control every day.